Fluid stewardship is needed, I think, at first, simply because fluids are the most common drug administered in an ICU patient or in a hospitalized patient, whether it is intentional or unintentional. And so certainly clinicians can be deliberate and prescribe a 1 liter bag of a crystalloid solution, for example. That is a very intentional prescription of an IV fluid therapy. But there are lots of additional fluids that patients may receive by indirect or inconsequential administration, what we call fluid creep. And that would be flushes for IV piggybacks or IV pushes, as well as the diluents that our medications are in. And so there's a decent amount of literature to suggest that fluid creep, those IV fluid flushes, as well as that drug diluent volume, contribute considerably to a patient's overall fluid balance. And when you talk about the safety, specifically the safety of fluid therapy and the need for fluid stewardship, giving IV fluid therapy, whether it's intentional or unintentional, can cause undue harm in that it can directly is associated and can cause fluid overload. And fluid overload has some pretty extensive consequences to patient care. Ultimately, higher incidence of mortality, renal replacement therapy, acute kidney injury, and those types of things.